Have you ever wondered why the prostate seems to get so much attention as men age? Is it simply a matter of health, or is there more to the story? Maybe you've come across advertisements claiming they have the ultimate solution to shrink your swollen prostate with just a miracle pill or a natural remedy. But how much of that is fact, and how much is pure myth? The truth may surprise you. Let's clear the air right away. The prostate does not swell. What happens in cases of benign prostatic enlargement, BPE, is actual cell growth. Think about it, just as your nose or ears continue to grow over the years due to the natural behavior of cartilage, your prostate follows a similar path. This natural enlargement, driven by age and biology, is not something that can be shrunk or reversed with a simple vitamin or a gentle massage. But why does the prostate grow in the first place? And why do some men experience significant enlargement while others don't? These are questions that science has yet to answer definitively, though inflammation and hormonal changes play significant roles. With that in mind, not every urinary issue points directly to your prostate. Conditions like urinary tract infections, diabetes, or even pelvic floor dysfunction could mimic prostate-related symptoms. This brings us to a critical point. The world is full of misinformation about prostate health. From misleading YouTube commercials to unscientific miracle solutions, navigating this space requires a balanced, informed approach. Your prostate health isn't just about physical well-being. It can influence your confidence, relationships, and even your intimate life. That's why it's essential to separate the myths from reality and focus on what truly matters. In this video, we'll take you through a deep dive into the truths of prostate health. You'll uncover the hidden reasons behind prostate enlargement, learn about effective treatments, and explore how to maintain not only your physical health, but also your sexual confidence as you age. If you haven't joined our community yet, I invite you to hit the subscribe button and turn on the notification bell so you're always up to date with our latest content. I'd love to hear your thoughts on today's discussion. If you find this content helpful, drop a 1 in the comments below. If it doesn't quite resonate with you, leave a 0. Your feedback is invaluable. It helps me craft videos that better suit your interests and needs. Now let's dive right in. It's hard to scroll through the internet or watch TV without stumbling upon an ad promising miraculous cures for your swollen prostate. These advertisements often paint a picture of a condition that sounds both alarming and easily solvable. Just take a pill, eat a specific food, or follow a simple regimen, and your prostate will shrink back to normal. Unfortunately, this portrayal is more fiction than fact. The idea of a swollen prostate oversimplifies a complex biological process and misleads millions of men looking for genuine solutions. To start, let's dispel this myth. The prostate does not swell like a bruise or an inflamed joint. What most people refer to as a swollen prostate is actually a condition known as benign prostatic enlargement, BPE. Unlike temporary swelling caused by an injury or infection, BPE is a result of cellular growth within the prostate gland. This growth isn't sudden or reversible with a quick fix. It's a natural process that occurs as men age. Think about how your ears and nose gradually enlarge over time due to cartilage growth. Similarly, the prostate continues to grow slowly and steadily. So why does this misunderstanding persist? Part of the problem lies in how easily people conflate unrelated conditions. Acute swelling of the prostate can occur in rare cases, such as bacterial prostatitis, but this is entirely different from the gradual enlargement seen in BPE. The ads and claims you see often fail to make this distinction, perpetuating the false belief that BPE can be reduced with simple measures. But here's the reality. The prostate's growth isn't something you can press away or shrink by popping a vitamin. To understand BPE, it's essential to recognize the biological changes happening inside the prostate. With age, hormonal shifts, especially involving testosterone and its byproduct, dihydrotestosterone, DHT, stimulate the prostate cells to multiply. Over time, this causes the gland to enlarge, potentially putting pressure on the urethra and leading to symptoms like difficulty urinating, frequent nighttime trips to the bathroom, or a weak urine stream. These symptoms aren't caused by swelling, but by the physical changes in the prostate size and structure. Some men might wonder if these changes are inevitable or if they can be prevented. While BPE is incredibly common, affecting approximately half of men over 50, it doesn't affect everyone in the same way. Factors like genetics, lifestyle, and overall health play a significant role. However, one thing is clear. BPE isn't a condition that can be reversed with a magic remedy. Claims suggesting otherwise are not only unscientific, but also potentially harmful, as they delay proper medical evaluation and treatment. It's also important to consider how this misinformation impacts more than just physical health. For many men, the idea of having a prostate issue can feel embarrassing or emasculating. This makes them more vulnerable to quick-fix solutions that promise to restore not only their health, but also their confidence. However, relying on these misleading treatments often leads to disappointment and a lack of progress in addressing the underlying issue. The science behind BPE paints a much clearer picture of the condition. It's a chronic, slow-developing process, akin to other age-related changes in the body. Unlike conditions such as acute bacterial prostatitis, which involves actual swelling due to infection, BPE represents steady cellular growth over decades. This distinction is crucial because it highlights why traditional remedies for inflammation or swelling won't work for BPE. Yet, this doesn't mean men are powerless. While you can't shrink your prostate size directly through diet or supplements alone, certain lifestyle changes can help alleviate symptoms and improve your overall quality of life. For instance, maintaining a healthy weight, staying active, and adopting a balanced diet rich in anti-inflammatory foods can make a difference. However, these measures address symptoms and general health rather than reversing the growth process itself. As we move forward, it's essential to approach prostate health with accurate information and realistic expectations. By understanding the biological realities of BPE and rejecting misleading claims, men can take meaningful steps toward managing their symptoms and maintaining their confidence. Now that we've debunked the myth of the swollen prostate, let's explore the deeper biological reasons behind prostate enlargement and what triggers this natural process as men age. Understanding the causes can provide greater insight into prevention and management. The prostate is a remarkable organ, but as men age, it begins to undergo significant changes. For some, these changes lead to noticeable symptoms, while for others, the process happens quietly in the background. Understanding the causes and mechanisms behind prostate growth is essential for separating myths from reality and for empowering men to take control of their health. One of the primary drivers of prostate enlargement is age itself. Just as graying hair and wrinkles are inevitable parts of getting older, so too is the slow growth of the prostate. Studies consistently show that most men over the age of 50 experience some degree of prostate enlargement, with the prevalence rising sharply among those in their 60s and 70s. This growth is closely linked to hormonal changes, particularly fluctuations in testosterone and its conversion to dihydrotestosterone, DHT. DHT, a more potent androgen, stimulates cellular activity in the prostate, causing its tissues to grow over time. However, aging isn't the sole factor at play. Chronic inflammation within the prostate is another significant contributor. Inflammation often occurs due to low-grade infections, autoimmune responses, or even dietary factors. While the inflammation itself may not cause immediate symptoms, it creates an environment where prostate cells are more likely to multiply. Over the years, this chronic irritation can accelerate the growth of the prostate, potentially worsening symptoms associated with benign prostatic enlargement, BPE. The biochemical changes happening within the prostate also play a pivotal role. The balance of enzymes and hormones shifts as men age, altering how prostate cells function and grow. For instance, higher levels of 5-alpha reductase, the enzyme responsible for converting testosterone into DHT, can lead to increased cell proliferation. Similarly, oxidative stress, a condition where harmful free radicals outpace the body's natural defenses, has been shown to damage prostate cells and contribute to enlargement. Yet, despite decades of research, some mysteries remain. One of the most puzzling questions is why some men experience severe BPE symptoms, while others with similar risk factors remain unaffected. Genetics appear to play a role, with studies identifying certain hereditary patterns that may predispose individuals to prostate issues. Lifestyle factors such as diet, exercise, and smoking also influence how the prostate grows and how symptoms manifest. Still, much remains unknown about why these factors interact differently in different individuals. This uncertainty underscores the importance of continued research. Increasingly, scientists are focusing on the role of inflammation and how it intersects with hormonal and biochemical changes. For example, some studies suggest that addressing inflammation early through diet, medications, or other interventions may slow the progression of prostate enlargement. This has profound implications for treatment, as it shifts the focus from reactive care to proactive prevention. Understanding the causes of prostate growth also helps dispel harmful myths. Many men assume that they've done something wrong when they experience BPE symptoms, but the truth is far more complex. Prostate growth is a natural process influenced by a combination of unavoidable factors like age and modifiable ones like lifestyle. Recognizing this can alleviate unnecessary guilt or anxiety and pave the way for effective management. The interplay of age, inflammation, biochemistry, and genetics paints a comprehensive picture of why the prostate grows, but it also raises important questions. Could early lifestyle changes prevent or delay this process? Are there ways to mitigate chronic inflammation before it becomes problematic? These are the kinds of questions that ongoing research seeks to answer, offering hope for a future where BPE is less disruptive to men's lives. Having explored the causes of prostate growth, the next step is understanding how to distinguish between its symptoms and those of other conditions. In the following section, we'll address common misconceptions such as the outdated concept of prostate congestion and why accurate diagnosis is crucial for effective treatment. The term prostate congestion may sound familiar to many, especially when searching online for answers about prostate health. Yet, this phrase has largely been abandoned in modern medical practice. Its origins lie in outdated theories about the prostate, which often link vague symptoms like discomfort or urinary issues to an imagined state of congestion or blockage. These misconceptions have persisted in popular culture, even though they lack scientific basis. Understanding why this term is no longer relevant and what might actually be causing similar symptoms is key to avoiding confusion and seeking proper treatment. In the past, prostate congestion was used to describe a range of symptoms thought to arise from the accumulation of fluids within the prostate. This theory suggested that the gland could become clogged, leading to discomfort, inflammation, or urinary difficulties. However, advances in urology have thoroughly debunked this notion. Modern medicine recognizes that the prostate doesn't function in isolation. Its symptoms often overlap with those of other conditions, making the concept of congestion both outdated and misleading. Many conditions can produce symptoms similar to what was once attributed to prostate congestion. For instance, urinary tract infections, UTIs, can cause frequent or painful urination, which some might mistakenly attribute to a prostate issue. UTIs occur when bacteria enter the urinary system, often resulting in inflammation and irritation that mimic prostate-related problems. Prostate cancer is another condition that shares overlapping symptoms with benign prostatic enlargement, BPE, and other prostate issues. While the thought of cancer can be alarming, it's important to remember that not all urinary difficulties indicate malignancy. Still, the similarity in symptoms underscores the importance of consulting a healthcare professional for accurate diagnosis. Another possible culprit is pelvic floor dysfunction, where the muscles around the pelvic area, including those that support the bladder and prostate, become overly tense or improperly coordinated. This can lead to urinary difficulties, discomfort, and even sexual dysfunction, often masquerading as a prostate-related issue. Beyond these conditions, systemic illnesses such as diabetes can also affect urinary function. Diabetes can lead to nerve damage and reduced bladder control, causing symptoms that overlap with prostate disorders. Similarly, bladder inflammation, known as cystitis, may mimic prostate-related discomfort, further complicating self-diagnosis. The danger of clinging to the outdated idea of prostate congestion lies in the temptation to self-diagnose. Men experiencing urinary or pelvic symptoms might turn to the internet or over-the-counter remedies, assuming they can treat the issue on their own. This approach not only delays proper care, but can also mask more serious underlying conditions. For example, ignoring symptoms of prostate cancer or mistaking them for a benign issue can have life-altering consequences if the condition goes untreated. Seeking professional advice is essential for differentiating between these possibilities. A urologist uses tools like digital rectal exams, DREs, blood tests for prostate-specific antigen, PSA, and imaging studies to pinpoint the exact cause of symptoms. These diagnostic methods are far more reliable than relying on outdated concepts like prostate congestion. Moreover, a thorough evaluation ensures that treatment plans are tailored to address the root cause rather than just the symptoms. Dispelling the myth of prostate congestion not only helps men understand their bodies better, but also highlights the importance of accurate, evidence-based medical guidance. Modern urology emphasizes the need for a holistic view of prostate health, one that considers the complex interplay of various conditions that can affect the urinary and reproductive systems. Having unraveled the misconceptions surrounding prostate congestion, we now turn to a more hopeful topic: the effectiveness and limitations of natural remedies for managing prostate symptoms. In the next section, we'll explore the science behind popular treatments like pumpkin seed oil and saw palmetto, separating fact from fiction. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. In the quest for better prostate health, many men turn to natural remedies, hoping for a safer, simpler alternative to medical treatments. Among the most popular options are pumpkin seed oil and saw palmetto, both widely marketed as solutions for relieving symptoms associated with prostate enlargement. While these remedies have gained considerable attention for their potential benefits, it's important to separate fact from fiction and understand their true capabilities and limitations. Pumpkin seed oil, often praised for its high content of beneficial compounds like phytosterols, is one of the most commonly recommended natural remedies for prostate health. Phytosterols are plant-based molecules that mimic cholesterol in their chemical structure and are believed to offer anti-inflammatory properties. In prostate health, inflammation is a significant driver of symptoms, so reducing it can provide noticeable relief. For many men, incorporating pumpkin seed oil into their routine has been shown to alleviate some of the discomfort associated with benign prostatic enlargement, BPE, such as frequent urination or weak urine flow. Saw palmetto, derived from the fruit of the Serenoa repens plant, has a similar reputation for addressing prostate-related symptoms. Its primary mechanism of action is thought to involve the inhibition of 5-alpha reductase, an enzyme responsible for converting testosterone into dihydrotestosterone, DHT. Because DHT plays a key role in stimulating prostate cell growth, reducing its activity can theoretically slow down or moderate prostate enlargement. Many men report experiencing a decrease in symptoms such as urgency and nighttime urination after taking saw palmetto supplements. Despite their popularity, it's essential to recognize the limitations of these natural remedies. Neither pumpkin seed oil nor saw palmetto has been shown to significantly reduce the size of an enlarged prostate. Their benefits are primarily symptomatic, meaning they can help manage the discomfort associated with BPE, but don't address the underlying issue of cellular growth. This makes them less effective than prescription medications like alpha blockers or 5-alpha reductase inhibitors, which are specifically designed to target the root causes of prostate enlargement. The anti-inflammatory properties of pumpkin seed oil and the DHT-blocking effects of saw palmetto are relatively mild compared to the actions of pharmaceutical drugs. For example, true 5-alpha reductase inhibitors like finasteride or dutasteride can dramatically reduce DHT levels, often leading to measurable decreases in prostate size over time. In contrast, the effects of saw palmetto are subtle and may not be sufficient for men with moderate to severe symptoms. While natural remedies are generally considered safe, they are not without risks, especially when used excessively or without proper guidance. One of the primary concerns with pumpkin seed oil is the accumulation of phytosterols in the body. Although phytosterols are beneficial in moderation, high doses have been linked to potential complications, including the buildup of deposits on heart valves and interference with microcirculation in the retina. A study from the University of Leipzig also raised concerns about an increased risk of coronary artery disease associated with high phytosterol intake. Saw palmetto, too, can cause side effects, although they tend to be mild. Some men report experiencing nausea, dizziness, or digestive issues while using saw palmetto supplements. However, more concerning is the possibility of delaying appropriate medical treatment by relying solely on natural remedies. Because saw palmetto does not reduce prostate size, it cannot prevent complications such as urinary retention or bladder damage, which can arise from untreated BPE. The allure of natural remedies often lies in their perceived simplicity and safety, but they should not be viewed as a cure-all. For men with mild symptoms, or those looking for additional support alongside medical treatments, options like pumpkin seed oil and saw palmetto can provide meaningful benefits. However, they should be used as part of a broader strategy that includes lifestyle changes, regular checkups, and, when necessary, prescription medications. For men considering natural remedies, moderation is key. Following recommended dosages and consulting with a healthcare provider can minimize the risks while maximizing the potential benefits. It's also worth noting that not all supplements are created equal. The market for dietary supplements is poorly regulated in many countries, meaning the quality and purity of products can vary widely. Choosing reputable brands and verifying ingredient lists are essential steps in ensuring safety and efficacy. Understanding the role of natural remedies in prostate health requires a balanced perspective. While they may not offer the same level of effectiveness as medical treatments, their ability to alleviate symptoms makes them a valuable tool for many men. However, recognizing their limitations and potential risks is equally important to make informed decisions about prostate care. As we've explored the benefits and drawbacks of natural remedies, it becomes clear that navigating prostate health requires a nuanced approach. Next, we'll delve into the critical importance of accurate diagnosis and why professional medical evaluation is indispensable for developing an effective treatment plan. Prostate health is a complex matter, and symptoms alone rarely tell the whole story. While conditions like benign prostatic enlargement, BPE, are common, other serious issues such as prostate cancer or infections can mimic its symptoms. This overlap makes professional medical evaluation by a specialist not only important but absolutely necessary. Without accurate diagnosis, men risk pursuing ineffective treatments, or worse, ignoring potentially life-threatening conditions. One of the key reasons to seek a specialist is the remarkable similarity in symptoms between different conditions. For instance, difficulty urinating, frequent nighttime urination, or a weak urine stream are hallmark signs of BPE. However, these same symptoms can also point to urinary tract infections, UTIs, bladder inflammation, or even prostate cancer. Only a trained urologist, equipped with diagnostic tools such as digital rectal exams, DREs, blood tests for prostate-specific antigen, PSA, or imaging studies, can determine the exact cause. Self-diagnosis or reliance on online resources, while tempting, is fraught with risks. Another factor that highlights the importance of professional evaluation is the need to match treatment to the underlying cause. For example, a man experiencing urinary discomfort might assume he has BPE and start taking saw palmetto supplements. While this might temporarily alleviate symptoms, it does nothing to address other potential issues, such as an infection requiring antibiotics or cancer necessitating aggressive treatment. Without the guidance of a specialist, the opportunity to choose the most effective approach is lost. Relying on unverified treatments or self-diagnosed remedies can have significant downsides. Many over-the-counter supplements claim to support prostate health, but often lack robust scientific backing. Using these products as a substitute for medical care can delay the discovery of serious conditions, such as prostate cancer, which benefits greatly from early intervention. Time lost to ineffective treatments is time that cancer may use to spread, reducing the chances of successful outcomes. Another danger of self-diagnosis lies in the potential to exacerbate existing conditions. For example, some natural remedies may interact poorly with medications, or aggravate certain health issues. Similarly, lifestyle changes based on incorrect assumptions about prostate health may do more harm than good. Specialists bring a level of expertise that ensures interventions are both safe and appropriate for each individual's circumstances. One of the most misunderstood aspects of prostate health is the role of PSA testing. While an elevated PSA level can indicate prostate cancer, it can also result from other conditions like BPE or prostatitis. Interpreting PSA results requires nuanced understanding, as high numbers alone are not definitive proof of cancer. Specialists can provide the context needed to make sense of these results, reducing unnecessary anxiety and avoiding invasive procedures when they're not needed. Seeing a urologist is not just about receiving a diagnosis, it's also about peace of mind. Many men delay seeking medical care out of fear of the unknown, fear of cancer, or even fear of invasive tests. However, most prostate issues are manageable when detected early, and knowing the exact nature of a condition often alleviates anxiety. Specialists provide clarity, helping men make informed decisions about their health and empowering them to take control of their well-being. One critical aspect of specialized diagnosis is the ability to explore all treatment options, including those that extend beyond natural remedies or basic medications. For example, men with severe BPE symptoms might benefit from minimally invasive surgical procedures, like transurethral resection of the prostate, TURP, or laser therapy, which can provide lasting relief. Without specialist input, these advanced options may remain unknown or inaccessible to those who could benefit most. The stakes are particularly high when it comes to conditions like prostate cancer. Early-stage prostate cancer often has no noticeable symptoms, making routine screenings and professional evaluations indispensable. When detected early, prostate cancer is highly treatable, with options ranging from active surveillance for low-risk cases to surgery or radiation for more aggressive forms. Without professional oversight, men may miss these crucial windows for intervention. Ultimately, the importance of specialized diagnosis lies in its ability to provide tailored care. Every man's health journey is unique, and a one-size-fits-all approach rarely works. Specialists not only diagnose, but also create individualized treatment plans that take into account a man's medical history, current health, and personal preferences. This level of care ensures the best possible outcomes, both physically and emotionally. With the critical role of professional diagnosis now clear, it's time to focus on the broader lessons of prostate health. In the final section, we'll summarize the key takeaways and offer practical advice for maintaining a healthy prostate and enhancing overall well-being. Prostate health is a subject that demands both awareness and action. Throughout this journey, we've uncovered critical insights that debunk myths, clarify misconceptions, and highlight the importance of professional care. As we conclude, it's essential to reinforce these key lessons and encourage meaningful steps toward maintaining not just a healthy prostate, but also a confident and vibrant life. One of the most important takeaways is the need to avoid being misled by advertisements and pseudoscientific claims. The idea of a quick fix for prostate enlargement, such as shrinking it with over-the-counter supplements or home remedies, is both unrealistic and potentially harmful. Misinformation thrives on fear and confusion, and falling victim to these claims can delay proper care or exacerbate existing conditions. By grounding decisions in verified information and rejecting sensationalized promises, men can make choices that truly benefit their health. Equally vital is the investment in specialized diagnosis. Prostate health is complex, with many conditions sharing similar symptoms but requiring vastly different treatments. A urologist's expertise ensures accurate identification of issues, whether they stem from benign prostatic enlargement, prostatitis, urinary tract infections, or more serious concerns like prostate cancer. Professional evaluations not only bring clarity, but also open the door to a range of treatment options tailored to individual needs. This level of precision is something no supplement or online article can provide. Recognizing the broader impact of prostate health is also crucial. Issues like frequent urination or discomfort are not just physical inconveniences, they can affect confidence, relationships, and quality of life. Addressing these concerns early and effectively allows men to regain control, improving both physical well-being and emotional resilience. Maintaining a proactive approach to health fosters a sense of empowerment, ensuring that men remain active participants in their care. As we wrap up, let's consider the importance of reliable resources. Prostate health is an evolving field, with ongoing research uncovering new insights and treatments. Staying informed through credible sources is key to navigating this landscape. Medical professionals, peer-reviewed studies, and trusted health organizations should form the foundation of any decision-making process. By seeking knowledge from reputable channels, men can avoid pitfalls and focus on strategies that truly work. Finally, a call to action. Take charge of your prostate health today. If you found the insights in this guide valuable, consider sharing them with others who might benefit. Subscribe to reliable platforms or channels that provide evidence-based information on men's health. And most importantly, schedule regular checkups with a healthcare provider to stay ahead of potential issues. Prostate health isn't just about managing symptoms, it's about fostering a lifestyle that prioritizes prevention, awareness, and well-being. The journey to better health begins with a single step, and now you have the tools and knowledge to make informed decisions. By staying vigilant, seeking professional guidance, and embracing a proactive approach, you can safeguard your health and enjoy a fulfilling, confident life. Remember, your prostate health is not just about aging, it's about living well at every stage of life. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who might benefit from this topic. Have any thoughts or personal experiences to share? Drop them in the comments below. I'd love to hear from you. And if you haven't already, click the subscribe button and ring the notification bell to join our community for more empowering content. Thank you for watching, and until next time, embrace the journey with confidence.